Welcome to NeuroVision Telemedicine, bringing you the highest quality of care in the comfort of your own home. Our virtual telemedicine assessments are our safest and most effective solution to serve you from a distance. In order to deliver telemedicine, by law, we must be able to obtain the same measurements as we do in person, and they must be directly comparable. To ensure optimal care, we've developed a system that allows us to do a complete functional vision assessment for concussion and TBI following the same format that we do in person. We do this using a web-based video conferencing platform that is designed according to telemedicine laws for security and privacy. There are 3 criteria a patient must meet in order to be eligible for a telemedicine assessment. You must have a recent ocular health exam or a routine exam with your primary care optometrist to ensure you have healthy eyes. Or if you do have any eye diseases, such as glaucoma, cataract, macular degeneration, or retinal detachment, to ensure it's being managed. You must have an up-to-date copy of your most recent prescription from your optometrist if you wear glasses already. We use this as your baseline prescription when prescribing a functional vision lens designed for you. You must have a portable device, such as a laptop, a tablet, or a phone, that can be used during the exam so that the video screen can be moved to different positions for various different tests. Once our capable staff has determined that you meet the criteria for a virtual functional vision assessment, here is what you can expect. We will deliver an equipment kit to you for the assessment. This equipment is fully sterilized prior to packaging, and it is used to take all the same measurements virtually as would be taken in person. We deliver this equipment package the most convenient way to you at your home. During your virtual assessment, the doctor, such as myself, will instruct you as to what you need to do with the equipment, the same as we do in person. You will have 3 separate appointments. A diagnostic appointment, which measures isolated visual skills to determine any underlying issues. A prescribing appointment to determine vision-body integration and treatment plan to address the issues. And the standardized visual perception testing appointment. During the first appointment with the doctor, we use the webcam to observe your eye movement patterns in many different capacities, the same as the doctor would observe your eye movement patterns in person. We are able to assess how well your eyes work as a team and how well your eyes and brain work together by various techniques using red and green glasses that measure neurovisual function. The doctor instructs you as to what to do, the same as we do in person during these measurements. In this appointment, we discover what's not working in your functional vision that can be underlying your symptoms such as dizziness, nausea, headache, reading, or screen sensitivity. During the second appointment with the doctor will work with you using a variety of different lenses in your kit. The doctor directs you as to what activity you will do with the lenses while observing your movement patterns, and will also have you look at various patterns while wearing different lenses, the same as is done in person. The third appointment is booked with our vision therapist, who will perform standardized visual perception testing. These are paper and pen tests that you will do while being supervised and instructed by the therapist as they observe you doing the test. What our functional vision assessment does for you? We will diagnose any functional vision impairment that you have. We will provide a full report of our results, including diagnoses, prescriptions, and recommendations for your treatment plan. We provide you with a prescription for therapeutic or rehabilitative lenses, which improve your symptoms if applicable, that you can fill, the same as is done in person. A virtual functional vision assessment does not replace a routine general eye exam from an optometrist. It does not test for eye diseases such as glaucoma, cataracts, macular degeneration, and retinal detachment. We refer you to your general optometrist for ocular health assessment. What are the benefits of having a virtual assessment versus in person? We have found that doing virtual appointments for our TBI and concussion patients has benefited them dramatically. You don't need to drive to the appointment. You avoid dealing with fluorescent lights. The testing is broken down into 3 appointments rather than 2, so we can spread the testing out better, making it less overload on your system. And of course, the testing is performed within the comfort of your own home. All of these factors help so that you don't aggravate your symptoms as much or get as exhausted. What about computer screen sensitivity? The assessment is designed so that you are not looking at the screen during the appointment. During conversation with the doctor, you will keep your eyes closed, look across the room away from the screen, or turn all video features off and use only the audio. Each individual test is 1 minute or less, the same as in person, and almost none of them involve looking at the computer screen. During each test, you are looking at different targets while the optometrist is measuring and observing how your eyes are moving and focusing. Each test can induce symptoms the same way whether the doctor is conducting the exam in person or virtually. For that reason, we allow lots of time for the appointment so that in between each test, you are closing your eyes and resting and giving time for your symptoms to lessen. What are the benefits of virtual assessment? I want you to have a virtual assessment because you will feel better than if you come in person. Less fatigue and less symptoms. You'll have shorter recovery time after the appointment. We can get more information because you're able to do more tests and less exhausted. I can do all the same diagnostic tests virtually for functional vision. The measurements are the same as in person. I'm able to communicate and connect better with you because your system isn't as overloaded, and I can see your facial expressions without a mask. I look forward to seeing you and serving you at your own personalized virtual functional vision assessment in the comfort of your own home. Give us a call and see if a personalized virtual vision assessment is right for you.